We're joined now by NIH and Coronavirus Task Force official Dr. Anthony Fauci. Thanks so much for joining us, Doctor.
Good to be with you.
So you testified today that the U.S. testing system is currently failing and that we're not set up for universal testing. Who's responsible for this failure?
You know, I don't think it's anyone that's responsible. What I was referring to is that the system as it was originally designed was really designed for a patient-to-doctor relationship in which the CDC would make a test, give it to the public health authorities in a particular state or local section, and that if someone needed a test, they would get an individual test. What it was not designed for was the broad, more global, as it were, screening, where you could not only just get a test for an individual, but you could go and essentially blanket the country to find out how many people are actually infected. That was something that was originally worked really very well for the systems that were in place then. Right now, we are making very rapid steps to going towards, I would hope in the next week or so, where we'd be able to get the commercial individuals involved, commercial companies, so that you can then much more easily get a test. But when I said it failed, I didn't mean it failed in the sense of what it was originally designed for. What it was originally designed for worked very well. But we've transcended that. We need to do much better. We need to get out there and get much more testing. And I believe that will be available relatively soon.
So you're optimistic that that will be able to fix this?
Yeah, no, we are going to fix it, for sure. And we're going to fix it. I mean, we have to admit that in the beginning we didn't have what we needed, but now we will fix it.
And so at this point, who needs to advocate in order to build the capacity for the universal virus testing?
No, it's already being done. I mean, the HHS under Secretary Azar, the CDC, the FDA, they're all working right now to get this done. And from what I heard at the task force meeting, literally just a few minutes ago, we're almost there. It's going to be within the next week or two, so probably even more like a week.
Why were the diagnostic tests approved by the World Health Organization not used?
Well, you know, it's a different test. It's a reasonable test. It's a good test. But like I mentioned early on, the test that we had was one that had been working and working well for the system that was involved. We will have our test soon.
At least 9 lawmakers who were present at Mar-a-Lago are now in self-quarantine due to their interaction with the Brazilian president's press secretary, who has tested positively for coronavirus. Should President Trump and Vice President Mike Pence be doing the same thing?
No, I think we're going to obviously leave that up to the White House and personal physician of the president and the vice president. So I won't comment that. I'm not very familiar with the details of that interaction, and that's why I would leave that to the president and the vice president's White House physician.
You have praised President Trump's new travel restrictions. Do you think that they go far enough, and should they also apply to Americans coming from Europe, like that infected lawyer who caused a spread in New Rochelle, New York?
Well, let's talk about travel restrictions for a moment. The early on decision to essentially stop the travel, put very significant travel restrictions on China, really saved us an awful lot of hurt, as it were, because we had some seeding of individuals from China, which led to then secondary infections, but they were relatively few considering what would have happened. You know, in contrast, the Europeans did not do that, and unfortunately, our colleagues in Italy are suffering for that because they're having a very bad situation in Italy. The more recent travel restrictions were based on scientific data. If you look at the number of new infections that are occurring globally, about 70%, the majority of them are coming from that European Union group there that we talked about last night. If you look at the states in the United States that have new cases, the majority of them are coming from that region. So I thought it was, even though it's a lot of difficulty and it was a difficult decision, I think it was the prudent and right decision to make, because when you want to stop the spread of virus, you do it 2 ways. You prevent anything from without coming in, and even as important, if not more importantly, you try to contain and mitigate the spread in the country. And that's why we're doing those kinds of things that are called social distancing, where you don't go where there are crowds. You telework where you can. You don't go on trips with crowded planes. And if you're an individual who's elderly or with chronic conditions, you absolutely don't go on a cruise ship.
And President Trump has said that COVID-19 will disappear, that, quote, one day it's like a miracle, it will disappear. Do you agree with that assessment?
Well, it depends on what you mean by disappear. We are still in for some significant infections going on right now. The curve is going like this, and if this acts like any other infection, if you don't do something about it and you do it really quickly, it's going to do that. And then ultimately, as all outbreaks, it will ultimately go down. But in this curve, there's a lot of suffering and death. What we want to do, and hopefully will be successful, is to blunt that curve. So instead of going way up, it goes like this. We're still going to have people getting sick and people will die, but it will be much less than if it just went up like that and we did nothing about it.
Yeah, so a colleague of mine was just saying, we should all just be prepared that we're going to get it. Do you think that that's the appropriate attitude?
No, I don't think it's the appropriate attitude. The appropriate attitude is to try and do something about it. And I just outlined the two ways: from without in, try and block it, and within, do whatever you can to distance people from each other so they don't spread. You can blunt that curve. To just throw up your hands and say we're not going to do anything about it is not appropriate and not good public health.
Now, doctors are restricting at this point who they can test. Can you explain who can get a test?
If a person goes to a physician and says they are sick, they need a test, the previous restrictions that we need to make clear are no longer there. The previous restriction was you had to have either come into contact with someone who was a known coronavirus patient or had some interaction with someone who was a contact. Now, you go in, there are no longer those restrictions. You go to your physician, you say, I feel sick, I may have some symptoms associated, and you get tested.
Okay, last question to you, Dr. Fauci, and again, we appreciate your time. What can you tell us about the treatment trials? What medications are helping?
Well, there are no medications that we know are helping because, as you said correctly, there's still treatment trials. So what's going on in China and what's going on here in the United States is testing a couple of already developed drugs to see if they have activity against the coronavirus. We've got to be careful that we say we have drugs. There's nothing been proven. You have to give the drug to hundreds of people and compare it to a situation where you just give them standard of care. And after a period of time, if that drug works, you make it available to people. But we're not there yet. We do not know if these drugs work.
Anything that you just want to say to the American people that you feel like we need to know?
Yes, I think that ahead we have to be prepared that we will get more infections. The way we can respond to it and mitigate it is to do the kind of distancing socially. In fact, if you go to coronavirus.gov or cdc.gov, you could take a look at what the kinds of things you should be doing. They're spelled out very clearly. It's easy to do. Just click on a computer and you'll see them.
Dr. Fauci, thank you so much for your time. We appreciate it.
Good to be with you.